Today's lecture is about the maxillary molars. First, I will present a quick review for the common characteristics of permanent molars, or what's called class traits. Then I'll move to the permanent maxillary molars. The molars, of course, the permanent molars are 12 in number, 6 in each arch and 3 in each quadrant. There are 3 types of molars: first, second, and third. What are the common characteristics of permanent molars, or what's called the class traits? First, they are the largest and strongest teeth in the mouth, whether they were maxillary or mandibular. The molars usually developed from 4 to 5 lobes, one lobe for each cusp. The crown and roots of molars are usually shorter than those of the premolars. However, their buccal, lingual, and mesodistal dimensions are greater, so they are wider buccolingually and mesodistally. This applies for the maxillary and mandibular molars. Also, they are characterized by having a wide occlusal table. As you can see here, the occlusal table is wide, whether for the maxillary or mandibular teeth or mandibular molars, so it is best suited for comminution of food. Also, molars are considered non-succedaneous teeth in that they do not replace the primary teeth. They erupt just distal to the primary second molars in the maxilla and mandible. While all other classes of permanent teeth are usually considered succedaneous because they replace their primary predecessors. The most developed of the 3 types of molars is the first molar. However, the third molar exhibits the most variable morphology in the mouth. The first permanent molars, whether they were maxillary or mandibular, usually are termed the 6-year molars. Why? Because they erupt at the age of 6 years just distal to the primary second molars. The first molars can be considered cornerstones of the dental arches, just like canines. This is due to the unique position in the middle of the fully developed adult jaw antero-posteriorly. Also, they play a significant role in establishment of dental occlusion. So, they are considered cornerstones of the dental arches. What is the function of molars? Permanent molars, whether maxillary or mandibular, perform the major function of mastication and comminution of food because of their broad and wide and large occlusal tables. Also, they support and maintain the vertical dimension of the lower third of the face. They also give support to the cheeks. Considering the permanent maxillary molars, in general, they are the largest and strongest teeth in the maxillary arch. They have large crowns with 4 well-developed functional cusps, 2 buccal and 2 lingual. However, the maxillary first molar is characterized by having an additional non-functional cusp called the cusp of Carabelli, or the 5th cusp or supplemental cusp. Therefore, it's developed from 5 lobes instead of 4, which is the number of lobes for the other maxillary molars. They also characterized by having 3 roots. These roots are widely separated and divergent, 2 buccal and 1 lingual. The lingual root, or the palatal root, is the largest of the 3. Regarding the characteristic features of the maxillary first molar, the maxillary first molar, of course, is the largest tooth in the dental arches, so it is the largest of all 3 molars in the upper arch. It is characterized by being the widest tooth buccolingually in dental arch. So it's the widest tooth buccolingually. It's the only tooth in the dental arches that is wider lingually than buccally. If we measure the mesodistal diameter of this tooth, it's greater on the lingual aspect than it is on the buccal. This is a characteristic for the maxillary first molar. It has 4 well-developed functioning cusps, 2 buccal and 2 lingual. In addition, there is a 1 supplemental non-functioning cusp called the cusp of Carabelli, or the 5th cusp. considered as an identification feature for the maxillary first molar. It's only present in the maxillary first molar. The maxillary first molar have three well-developed roots. They are widely separated. Then they converge apically. The two buccals are shorter than the large lingual root. Regarding the chronology of the maxillary first molar, the first molars, whether maxillary or mandibular, shows the first evidence of calcification at birth. So the first primary tooth to show the evidence of calcification are the first molars. The inul is completed 3 to 4 years, eruption is at 6, therefore it's called the 6-year molar, and root is completed 3 years later, about 9 to 10. A detailed description of the maxillary first molar from all aspects, starting with the buccal aspect. The outline of the cervical line is irregular and it's convex root-wise. The mesial and distal outlines. The mesial outline is straight. This is the mesial and this is the distal. It's straight from the cervical area or cervical line toward the mesial contact area, which is sharply convex. Then it will merge with the mesial slope of the mesio-buccal cusp. The mesial contact area is located at the junction between the occlusal and middle thirds of the crown. While the distal outline is more curved toward or from the cervical line toward the distal contact area, which is located in the middle of the middle third, and it will be confluent with the distal slope of the distal buccal cusp. What cusps can be seen from this aspect? Parts of the forecusp are seen. Of course, in front are the mesiobuccal cusp. This is the mesiobuccal and the distobuccal cusp. We can see also the tip of the large mesiolingual cusp between the two buccal cusps. And part of the distal aspect can be seen due to the distal tapering of the crown of the maxillary first molar. Regarding the mesiobuccal cusp, the slopes of the mesiobuccal cusp meet at an obtuse angle. However, the slopes of the distobuccal cusp meet at a right angle, which makes the tip of the distobuccal cusp sharper than the tip of the mesiobuccal cusp. So the mesiobuccal cusp is broad, while the distobuccal cusp is sharp. There is the developmental group between these two cusps called the buccal developmental group. It is located in the center of the buccal surface, mediodistally, and it will end in the center of the buccal surface, occluso-cervically. From this aspect, we can see the three roots, the two buccal roots, the mesiobuccal and the distobuccal, and the long lingual root, which is 1 millimeter longer than the two buccal roots. The axes of these roots are, as it's obvious here, are inclined distally. The point of bifurcation of these three roots is located at about 4 millimeters away from the cervical line, or at about 1/3 the length of the root. And they separate, when they bifurcate or trifurcate, they usually separate from each other. Then they tend to converge again at their apical area. Finally, there is a deep developmental groove on the buccal surface extending from the point of bifurcation and ends in a shallow depression here near the cervical line. Regarding the lingual aspect, the mesial, this will be the mesial, and this is the distal. The mesial outline is straight at the beginning, then when it reaches the mesial contact area, it will merge with the slope of the mesial slope of the mesiolingual cusp at about 90-degree angle. While the distal outline is more curved and it's confluent with the curvature of the distolingual cusp, so it will form a semicircular arc. The only cusp can be seen from this aspect are the lingual cusp. This is the mesiolingual cusp and this is the distolingual cusp. The mesiolingual cusp is much larger than the distolingual cusp, and it is always the longest cusp. Its slope meet at an obtuse angle to each other, and it occupies about 3/5, the mesiodistal diameter. So if we measure the mesiodistal diameter, the mesiolingual cusp will form 3/5 of this distance, while the remaining 2/5 will be occupied by the distolingual cusp. The distolingual cusp is smooth and spheroidal, and the cusp slopes have no angulation. It will form a semicircular arc. There is the lingual developmental groove which extends between the two lingual cusps, the mesiolingual and the distolingual cusp. It ends in the center of the lingual aspect of the crown. There is another cusp which is non-functional called the fifth cusp or the cusp of Carabelli. It is located about 2 millimeters to the cervical or away from the cusp slopes of the mesiolingual cusp. The fifth cusp is presented in different forms. It may be very prominent, it may appear as a shallow groove or as a pit, or it may be completely absent. There is a shallow depression which extends from the terminus of the lingual cusp, the lingual groove, and it runs in an apical direction, ends in the middle third of the lingual root. The three roots are visible from this aspect. This is the lingual, and this is the mesiobuccal, and this is the distobuccal. The lingual root is the longest, and it's a broad mesiodistally from this aspect, and end in a round and blunt apex. Regarding the mesial aspect, the geometric outline is trapezoid with the longest of the parallel side toward the cervix and the shortest toward the occlusal area. So the tips or the cusp tips are within the confines of the root trunk, just like all other maxillary posterior teeth. The buccal crest of curvature is located in the cervical third of the crown, and then the outline becomes straight toward the tip of the mesiobuccal cusp, while the lingual crest of curvature is located in the cervical portion of the middle third of the crown, and the outline is convex toward the tip of the mesiolingual cusp. From this aspect, only three cusps are visible: the mesiobuccal, this is the mesiobuccal, the mesiolingual, and the fifth cusp or the cusp of Carabelli. The mesial marginal ridge is curved and located about 1/5 the length from the occlusal surface toward the cervical line. From this aspect, only two roots are seen: the mesiobuccal root, which is broad buccolingually, and the lingual root, which is longer, about 1 millimeter longer than the mesiobuccal root. The lingual root is banana-shaped, and it's narrow from this aspect. So, as a rule, the mesiobuccal root is wide buccolingually and narrow mesiodistally, while the lingual root is narrow buccolingually and wide mesiodistally, as was obvious from the lingual view. So, as mentioned before, the mesiobuccal root is broad and the lingual root is narrow. Moving toward the distal aspect, the main differences between the distal and mesial is that the buccolingual measurement of the crown on the distal aspect is less than that on the mesial. This is due to the distal tapering, so part of the buccal aspect can be seen from this view. Regarding the distal marginal ridge, it is shorter and dips in a cervical direction. It's more curved, so this will result in exposure of the triangular ridges of the distal cusp. The bifurcation in this aspect is located at an apical position. It's about 5 millimeters away from the cervical line, so it's at higher level compared with the other two areas, whether from the mesial or from the buccal. Three roots can be seen from this aspect: the long and narrow lingual root, the small distobuccal root, this is the distobuccal, and in the background we can see the broad mesiobuccal root. So this is the lingual, this is the distal buccal, and this is the mesial buccal. The occlusal aspect. So the geometric outline is rhomboidal. It is wider mesially than distally, if we consider the buccolingual dimension. And if we consider the mesiodistal dimension, it's wider lingually than buccally. So it will give a rhomboidal outline. There are two acute angles and two obtuse. The two acute angles represent the mesiobuccal and the distal lingual angles, while the two obtuse angles represents the distal buccal and the mesiolingual. There are four major cusps which are well developed. These are moving in a clockwise direction. This is the mesiobuccal cusp, this is the mesiolingual cusp, this is the distal lingual cusp, and this is the distal buccal cusp. So these are the major cusp. And there is one minor cusp, which is non-functional. This is the cusp of Carabelli, or tubercle of Carabelli. So four major and one minor cusp. The largest cusp is the mesiolingual cusp. It is considered the largest cusp, while the smallest is the distal lingual. This will be the smallest cusp. If we consider this tooth developmentally, only three of these four major cusps are considered primary. They will form what represent a triangle or a trigon. These are the distal buccal, mesiobuccal, and the mesiolingual. These are considered the primary, while the other two, the distal lingual and the fifth cusp, are considered secondary. Why? Because the distal lingual cusp, as you can see here, moving from the maxillary first molar to the maxillary third molar, the distal lingual, represented by this shaded area, the distal lingual cusp becomes progressively smaller and sometimes even disappearing in the maxillary third molar. So these three cusps, the arrangement of these three cusps in a form of a triangle is called the maxillary molar primary cusp triangle. Moving to the details of the occlusal table, the maxillary first molar characterized by having two major fossa and two minor fossa. The two major fossa are the central fossa. This is the central fossa, which is roughly triangular and large. It's located mesial to the oblique ridge. This is the oblique ridge, and this is the central fossa. While the distal fossa is linear and located distal to the oblique ridge. The central fossa is characterized by having a central pit in its center. Many grooves radiate from this pit in different directions. The two minor fossae are the mesial, this is the mesial and this is the distal, are the mesial triangular fossa, which is located just distal to the mesial marginal ridge, and the distal triangular fossa, which is located just mesial to the distal triangular ridge. Finally, there is the oblique ridge, which crosses, this is the oblique ridge, it crosses the occlusal surface obliquely. It's formed by the union of the triangular ridge, this is the triangular ridge of the distal buccal cusp, with the distal cusp ridge of the mesiolingual cusp. It is reduced in height in the center of the occlusal surface, becoming more equivalent to the length or the height of the oblique ridges. As you can see in this figure, this is the oblique ridge. As you can see here, it is reduced in height in the center, approaching the height of the mesial and the distal marginal ridges. The occlusal surface or table is characterized by having 5 developmental groups. These are, first, from the central pit, there is the central developmental group, which radiates from the central pit and ends in the mesial triangular fossa. There is the buccal developmental group, which radiates also from the central pit and runs toward the buccal surface between the two buccal cusps. The third groove that radiates from the central pit is the transverse groove of the oblique ridge. It's a short groove runs across the oblique ridge and joins the central fossa and the distal fossa. There is the distal oblique groove. This is the distal oblique groove. It runs from the distal triangular fossa and then extend obliquely to join the lingual groove or to become continuous with the lingual groove, which ends in the lingual surface between the two lingual cusps. There are also three developmental pits. The central developmental pit, which lies in the center of the central fossa, it's deep and it's prone to caries. And from this pit, three grooves originate: the buccal developmental groove. Sorry, this is the buccal developmental groove. This is the central developmental groove, and the transverse groove of the oblique ridge. And the mesial pit, which is located in the apex of the mesial triangular fossa. This is the mesial triangular fossa. And there is the distal pit, which is located in the apex of the distal triangular fossa. There is another developmental groove called the fifth cusp groove, which separates the cusp of Carabelli from the mesiolingual cusp, but it's not part of the occlusal table. Regarding the anatomic variation, the morphology of the maxillary first molar does not vary much, except for the widely varied expression of the Carabelli trait. So sometimes the cusp of Carabelli is very prominent, just like a large cusp. Sometimes it is just like a small tubercle, or maybe presented just by a shallow groove or pit on the lingual surface of the mesiolingual cusp, or sometimes it may be completely absent.